Right, ladies and gentlemen, it's time to start. Welcome to this meeting of the governing body of Coastal West Sussex CCG. Nice to see so many people in the audience. We have got time for public questions to start, and we'll get through as many of those as we can. We'll go through the... Sorry.
Is it on?
Is the microphone? Yes. Sorry, can you hear now? Yeah, okay. I'll try and shout a bit louder as well. Hopefully we can get the message across. Time for public questions. We have one written question submitted in advance from John Gooderham this morning. Is John with us? Sorry. Welcome, and thanks again for keeping this in focus for us. We've had a written response which is on the seats for everybody. Questions concerning radiotherapy services. John, do you have any supplementary questions?
If I may,
yes,
Kieran, and thanks very much for a very full and informative reply, with which I'm totally satisfied, for the record.
Thank you.
My supplementary, which I hope I've... Sorry, do I need that?
No.
I do need that. And there's me thinking I talk loud enough, but never mind. My supplementary then, which I think I've just about given Katie notice of, is that one of the many complexities of having radiotherapy services at Chichester is, of course, that Chichester is not currently within the catchment area of Brighton. So you get this nonsense where you might have some Chichester patients not being able to be treated for not being able to receive their radiotherapy in Chichester, which is patently absurd. So there needs to be some sort of an arrangement reached, an agreement reached with Portsmouth, so that the facility built by Brighton in Chichester can, I'm sorry this is a bit long-winded, Kieran, can also be used by Portsmouth catchment patients. Anyway, the National Cancer Director told me last night in the email that in fact such an arrangement will be made. There will be a memorandum of understanding between Portsmouth, Chichester and Brighton. That strikes me as a very good idea. Katie, do you agree, please? In principle.
In principle, absolutely, it's a really good idea, and John, I'd like to echo Kieran's sentiment of thank you for making sure that this absolutely stays on our agenda, on everybody's agenda, because this couldn't be more important. Marie, you are having not been here for the last year. Marie is more au fait with the details, so I don't know if she would like to add, but absolutely in principle, yes.
So I think, John, just supporting what Katie said, is that we want to be really clear about what the content of that memorandum of understanding is, because I think one of the issues that keeps coming back, as you know, is the concern about the fact is that there's been quite a lot of push from Portsmouth to say there shouldn't be any provision on the Chichester site, that all patients should be going directly to Portsmouth. So I think we need to understand what that decision means, because it does feel, and Katie and I spoke about this yesterday, is an endless cycle of we always need another business case. So we will pursue that with the specialist commissioning side in terms of saying, can we have an early sight of that, so that if there's anything we can do to influence the content, we'll do that.
Thank you, that sounds great, Kieran. And I will, of course, if I get sight of that memorandum or draft first, I will ensure that you get sight of it, and we can all keep in the loop.
Thank you.
Thank you.
John.
Thank you, John. Thank you very much indeed.
Oh, excuse me if I leave.
No, thank you for coming. Right, there's an opportunity for other questions about any other subject anyone wishes to ask. So would anyone like to ask any further questions? Yep. Would you like to have the microphone? Sorry.
Thank you, Kieran. Basically, it's on your programme expenditure. I note that you're saying, in addition to this, acute expenditure is forecast to be overspent by 7 million. Could you confirm that that 7 million, I assume, is the acute spend?
No.
In the acute hospital?
It is absolutely in the acute hospital. It covers a number of lines of services. But
would, in that 7 million overspend, be where you've had pressure, where the hospital have had pressure of extra patients going in, emergency patients,
Absolutely.
and having to outsource patients who are on the waiting list, therefore them having to go into Nuffield, Goring Hall, etc., as they seem to go in week after week. That surely must be extra to what was originally forecast at the beginning of the financial year.
Our plan at the start of the year was adjusted to address the backlog for elective waiting lists to reduce the backlog.
Yes.
And that is included within that overspend in the acute sector.
Yes, but what I'm trying to say is if the acute hospitals have had extremely high level of emergency patients admitted, creating shortage of beds and elective lists being cancelled, surely that's even extra backlog that has to be addressed. So therefore, could in that 7 million be that extra revenue that has to be paid for those patients to be coming within the 18 weeks?
Absolutely. One of the key issues that we have is that the demand for non-elective services, the urgent emergency care services, has driven a requirement to escalate into the elective beds within the hospital. And clearly, in order to achieve the 18-week target and reduce the backlog, we need to find capacity elsewhere, and that's been part of some of the driver in respect of use of the independent sector.
So can I just ask Marie to add to that from the operational point of view?
Yeah, so at the start of the year, we'd anticipated that the backlog wasn't going to be as high as it was in April. So therefore, we had to plan to spend more money in the private sector than originally thought. We've had some overactivity in the private sector, which is a different cost pressure that we've experienced to the 7 million that you've seen with the acute. So we've had a lot of additional activity from urgent care in terms of attendances at A&E and admissions. You're absolutely right. So we've seen a rise in activity in that, particularly at Western, but we've seen a rise in elective activity in a range of NHS providers as well as the private sector in terms of our elective work.
Sorry, but then the elective surgery that's being carried out in the private sector, I assume there's an arranged tariff, because if they if that episode cannot continue in the hospital and it has to go to the private sector, do you have a special tariff rate for those patients?
So we pay the NHS tariff. We don't pay over and above that.
Right.
Thank you for those questions. Anyone else like to ask anything this morning? Yeah.
Following on from Sue's question, Ian Strand, following on from Sue's question, if I may, Miri, you, through the chair, you just said your activity through A&E. I always understood that access through A&E isn't paid for by the CCG because that is part and parcel of the initial entry. So you shouldn't be paying anything if you're going to A&E. Could you confirm that as an extra?
No, we have to pay for attendances at A&E. There's a tariff for an A&E attendance. It's just a different tariff to the elective tariff in terms of work.
It's all part of the national tariff.
Yes, I remember bringing this up at a patient panel years ago where they were paying twice for it, once through the GP's scenario and once through the PCT scenario and CCG scenario. That's only why I asked that question. That wasn't on my original one. It's only because it's just cropped up. Yeah, thank you. Yes, my questions, please, if I may. Following on from correspondence about the location of IT services and the risk of data being compromised, what is the CCG doing about this type of risk, both for main and peripheral IT servers within its NHS suppliers, including GPs, and non-NHS establishments, external suppliers, and their subcontractors? And B, would it not be prudent for this type of risk to be shown on the CWS risk register?
Who wants to say it? Well, Chris.
Hi, as the chairman of audit, I will comment on whether or not it should be on the risk register. the issue of confidentiality of data and how data is maintained both within the NHS but also how it's distributed outside of the NHS is something that's governed extremely carefully and is monitored on an annual and semi-annual basis as something that's called the Information Governance Framework. This sets out incredibly clear and detailed standards that have to be adhered to by any NHS organisation holding data and any NHS employee handling data. And we both subject this to our own internal management processes and review against the Information Governance Framework, but we also use our internal auditors to perform an internal audit that we are managing all those processes appropriately. So I am personally reassured when I see the standards that have been set, when I see the internal management processes we employ, and when I see the results of the internal audit, that we are paying due regard to the management of patient data, its confidentiality, and how it's distributed and handled. I don't see at this point any issue that has arisen that would cause us to add anything to the risk register on the basis of evidence that we have an unmanaged risk. I accept that there always is a risk, but I feel confident that we are currently managing that appropriately. We are in a slightly different position to providers in terms of the information that we have about patients, and I think there is a higher level of risk amongst the providers than there is amongst the commissioners. So I don't feel there's a need for it to be currently on the risk register. I do feel there is a need for us to be constantly vigilant, and at the moment I'm assured we are.
Yes, I mentioned that, you see, because you got the cyber attack on the risk register. If after what you've said, then there must be, therefore, if you're following all the guidelines that you just said and agreeing to them, then the cyber attack shouldn't be on the risk register, by converse argument.
Cyber attack is a very interesting aspect to this. Cyber attack is something we cannot fundamentally mitigate fully against, any more than any user of a home PC, any user of, or any organisation that manages and runs large networks with multiple access points to those networks. So cyber attack is something we do have to be extremely vigilant of, but I think is in itself slightly different to how you manage confidentiality of data and handle it. So in that regard, I do think it's appropriate that it's there, but I still feel that the risk is relatively, and I say relatively cautiously, minimal from a commissioner's point of view compared to a provider's point of view, because of, and also we don't ourselves develop and maintain databases of information. We don't manage those servers.
That's why I asked the question, you see, because you don't do it yourself. That's why it's so important both for the subcontractors with the looking at them using it, which is why I asked my question, because in my opinion, I think that's just as important as your cyber one, because you don't know what mainframe or IT server the GP is using, for example.
No, but in the same way that the Information Governance Framework mandates exactly how we manage the risk, it also mandates exactly how all...
well, presumably you have to check. Do you have an audit of that?
I would have to double check, but I believe...
If you're saying contractor A, we're going to use your system.
Can I ask Glyn, because he can probably help?
Yes, one of my, I've got a couple of requirements as a CCG, especially for primary care, and one of them is to make sure that the primary care systems comply, and also keep a register of what software and hardware those primary care organisations hold. We do that. There's a lot of hardware and software that each of the GPs hold, and there's about 30,000 items on that register that we keep, which is the requirement that we fulfilled our requirement by doing that.
Yeah, but where is the base of the IT server? It might not be in this country.
Can I suggest, we're probably getting into too much level of detail, but also we're running out of time. What I suggest is if we produce something that sets out the arrangements we've got, answers those questions, and then publish that as an answer to the
I
question.
just have one quickie
Okay.
then, if I may. Nice to see Katie back where she is. I hope everything is going well for her. Can I return to a previous request by myself once again about the inclusion of Q&A from the general public in the board, not in the board papers, but with the board papers, and being commented upon on the board website? The answer that is not part of the meeting, or you can see the video, doesn't really hold water, because the video is edited. The video can be edited at any time and taken down, as can the main video. And there is no public record. I mean, I come here today and I picked up the answers to the questions last time. Well, nowhere is that recorded unless you come to this meeting. Now, there are lots of people who haven't got PCs, can't get to this meeting because they're at work, but need to know what questions and answers were asked at the meeting. Is that not a reasonable...
Sorry, can I just be clear? Because
Yeah.
the answers to the written answers are on the website too. They're
Where?
published.
Alongside the papers. So this will go up on the website.
Well, I must admit, I haven't been able to find them. I'll recheck, but I've...
Okay, well, we'll
yeah.
recheck as well. I mean, the intention is
Yeah.
to publish the questions and the answers. We will make sure that does happen, and the point is well made. I also want to say, I mean, and it will come up during the meeting, we're having another look at how our governance arrangements work. So I think we've heard, as you've said, you've answered the questions before. What we'll do is make sure we are as transparent as we can be with all of the questions and answers that are asked.
About, what, 20 or 30 people out of... 40%.
I agree. Yeah. So the more that we can make that information available, the better. And I think that's the principle we'd certainly agree with. Thank you very much to everybody for the questions this morning. I'm going to move into the main body of the meeting now, if I may.